Hello, my name's John Thurman, and I'm an author, a therapist, and a work-life consultant. And today I want to talk with you a few minutes about self-care. And really what this is all about is helping first responders and medical personnel avoid the impacts of compassion fatigue, vicarious trauma, and burnout. You know, this has been a crazy year these past 12 months, nearly 12 months. And one of the things the research tells us is there have been a number of accelerants that are impacting healthcare workers and first responders. And those are patient volume, the acuteness of some of the illnesses and people we're seeing, resource challenges, both in regards to PPE as well as personnel and staffing. We've also had to deal with patient isolation from the families, and in many cases, nurses and physicians and other healthcare workers are that final living human being that patients see before they succumb to the illness. And I know many of you out there have done smart device farewells for family members, tough stuff we never trained for. And then we have the whole thing around COVID right now is even today, as we're seeing a decrease in hospitalizations, lower levels of acuity in really sick people, there's still a lot of uncertainty. There's ever-evolving treatment information. A matter of fact, you can listen to the news and you find out mask on, mask off, 2 mask, no mask, a lot of confusion. So there's still a lot of uncertainty and stress revolving around the whole COVID incident and all the stuff we've dealt with and will continue to deal with. And then the additional stressor of the external factors, how things have gotten politicized, funding, and adapting for the future. You know, how will we manage COVID both in an outpatient personal experience, but also in an inpatient setting? So with that in mind, I just wanted to remind you that while many of our first responders and healthcare workers have been spot on, have been there day in and day out, done lots of overtime, and poured their lives into taking care of patients, I'm scared that we're going to see kind of a backlash of people struggling with compassion fatigue, vicarious traumatization, and burnout. And I love what Nietzsche said. He said, whoever fights the monster should see to it that in the process he or she doesn't become a monster. And if you gaze long enough into the abyss will gaze back at you. That just means as we deal with people's pain and suffering and death and grief-stricken families, not to mention the stress in the work environment of dealing with all the things you've had to deal with this past year, it means that if we're not careful, we can become victims ourselves. And what I hope you'll find in this brief video is some help. Well, let's look at the different definitions. Compassion fatigue is the emotional erosion or strain of exposure to working with those suffering from the consequences of traumatic events like pandemics, man-made disasters, natural disasters, and acts of terror. It occurs when helpers are unable to regroup, refuel, and regenerate. The second is vicarious trauma. This could also be indicators of PTS, post-traumatic stress, which is not post-traumatic stress disorder. Post-traumatic stress is a normal occurrence to people when they've been exposed to trauma outside of their normal realm. Vicarious traumatization is deeper. And with vicarious trauma, there's a profound shift in the worldview that happens to helping professionals when they work with clients who've experienced trauma or natural disasters and pandemics. Helpers notice that their fundamental beliefs about people and the worldview are altered due to this, and even damaged sometimes and desensitized due to repeated exposure to trauma. And then finally, there's burnout. This term came into existence in the 80s, and it describes an emotional, physical, existential, or spiritual exhaustion when workers have a combination of low job satisfaction, they feel powerless, or they feel overwhelmed. And in my work as a consultant, I see a lot of people that are dealing with the residual issues of being overwhelmed at work and feeling pushed really in places they've never been before. However, burnout does not mean that your worldview has changed at all. So those are 3 differences. The compassion fatigue and the vicarious traumatization we can treat while you're still working. Burnout, many times you have to recalibrate and find something else for you to do while you're in the healing process. Now, what is the number one way to mitigate this stuff? What is the one thing that you and I can do that costs me nothing to mitigate and lessen the impact of these three things, these different workplace stressors? Well, self-care. And it's been a while since I've flown on an aircraft, but normally when you fly on a plane, in the safety briefing, they say something like, in the event of sudden cabin depressurization, a mask will drop. Didn't mean to hit my mic there. First, place the mask on your face and help someone else. They know that you've got to take care of yourself first. So what are some benefits of self-care? Well, improve self-esteem, self-compassion, increase insight and sharpness in decision-making. You boost your immune system. You enhance your stress management skills and boost those resilience muscles. You have a greater ability to focus and to lead to better outcomes, both at work and at home and in your relationships. It also gives you a deeper sense of meaning and a deeper sense of spirituality and connectedness to something bigger than you. It also heightens the connection to others. When you're doing self-care, you take care of yourself, but you're also more aware of the needs of others, and you're able to reach out to them without breaching boundaries. And then finally, you have a better control of setting your own boundaries in your personal life, your relationships, and work. So self-care really is the key here. Now, I don't know what you're going through. Maybe you're stuck, but let me tell you some things you can do. If you work for an organization that has an employee assistance program, tap into that resource. It can be helpful. Or if you need to talk to someone, I'm located in Albuquerque, New Mexico, and I am a work-life consultant. I offer a free initial consultation. And if you'd like to talk, feel free just to give me a call on my landline at 505-343-2011 or my mobile number, 505-362-6705. I appreciate the work you do. I've had some experience. I worked in the burn unit at Brooke Army Medical Center for a season. I appreciate the work you do and the sacrifices you made and the commitment you have to take care of others. I hope this has been helpful. God bless, be safe, and have a wonderful day.